Good afternoon, and thank you everybody for joining us. My name is Patricia Houston, and I'm from Family Partners of Morris and Sussex counties. Right here is joining me, Monica Gilles. Welcome, Monica.
Thank you, Patricia. Thank you for having me. I just want to tell you a little bit about myself. I am a certified tobacco treatment specialist, in addition to being a registered respiratory therapist. I am the clinical care coordinator for the Cancer Institute at Screen NJ.
Thank you, Monica. And I just want to remind everybody that Rutgers Cancer Institute of New Jersey has been doing presentations with us in relation to different programs and different educational workshops that they have. All those videos are in here in the YouTube channel of the organization. So all those videos are available for the community and the provider. Monica, if you don't mind, would you please tell us a little bit about yourself? I know that you just provide a little introduction, but in relation to the topic that you're going to be discussing today, so that everybody's familiar with what you're going to be talking.
Sure. The thing is that I'm very passionate about educating the community because I feel that the more education someone has, the better choices they can make, especially when I do educate about tobacco and some of the health risk involved. And some people were very amazed to hear a lot of information about some of the chemicals that are in their tobacco products. So I'm passionate about educating people to empower them to make better decisions.
Thank you very much. And I know Monica has a PowerPoint. So Monica, you're more than welcome to take the lead. And I just want to remind everybody the presentation is going to be recorded. At the end, we're going to turn off the recorder and we are going to allow time for Q&A. So welcome everybody and enjoy this presentation.
Okay, today we're talking about lung cancer screenings. We have new guidelines for a life-saving screening test. Please keep your microphones muted, and of course, I will answer questions at the end. And if you want to put your questions in the chat box during the presentation, please don't hesitate to use the chat box. Our agenda, we're going to discuss what are these tobacco products, overview of combustible and other smokeless tobacco products, health risk associated with tobacco use, lung cancer screening, why should you quit tobacco products, understand why it is difficult to quit, learn the financial burden of smoking, and New Jersey services, and then we'll have our question and answer session. Statement from the CDC for the Center of Disease Control. I do like to start off with this just to remind everyone, cigarette smoking remains the leading cause of preventable disease, disability, and death in the United States. So you have 5 people, 1 in 5 will unfortunately die from cancer caused by cigarette smoking. We have about 480,000 deaths every single year. So just be mindful why we do these presentations to educate people so they can understand. When we talk about the underestimation of nicotine and products, I have several different products that contain nicotine. So it's not your traditional cigarettes. There are many products on the market. But what we want to do is make sure people have the right information. Someone may have gone from smoking a pack of cigarettes a day to say, you know what, I don't smoke a pack of cigarettes anymore. I'm smoking smaller cigars, and I might have 2 or 3, whereas a pack of cigarettes had 20 in there. But what the person may not realize is that the amount of nicotine that's involved in 1 or 2 cigarettes, in 1 or 2 cigars may be equivalent to more than a pack of cigarettes. For instance, we have the e-cigarettes that people have pods that are pre-filled, or you can buy the aerosol to fill them. So 1 pod can have an equivalent of 1 pack or more. So if someone is using an e-cigarette and they're using 2 to 3 pods a day, they are smoking the equivalent of more than 2 packs of cigarettes. So we also have hookah, which is smokeless. We still have traditional people that use pipes. There's the chewing tobacco. And just so you could understand, there are mini cigars, regular cigars. So there's many ways for someone to get their products. When it comes to electronic cigarettes, The other term you might hear someone say is ends, or you might hear vaping device, a vape pen, or even an e-hookah. These solutions contain nicotine, which is the addictive component, the addictive chemical that gets someone to keep smoking. And a lot of these are now designed to look like regular everyday items. If you look at the one near the apple, we know there's a situation with our middle schoolers and our high school students that are vaping in front of their professors and teachers, and they have no idea that that's what they're using because they look like USB ports. Some of them look like little flashlights. Some of them even look like phone carrying cases. So there's many ways to disguise the e-cigarettes or electronic devices to smoke. And it's smokeless, so it's even easier to conceal. When it comes to the invention of electronic cigarettes, I bring this up to show you what has been happening. So for instance, this pharmacist from Beijing was concerned about his father's heavy smoking, right? His father, unfortunately, succumbed to lung cancer. He himself was a smoker. The pharmacist himself was a smoker. So he figured out, let him try the e-cigarettes. And this was back in 2003. He actually was able to sell this product and it hit the US market back in 2007. But as of 2019, the research I did on Han Lick was that he's now a dual user of cigarettes and vaping, which is something that we do need to be concerned about when addressing smoking. Juul is one of the most popular brands in the United States, and it does contain a high level of nicotine. I had mentioned this briefly. You see, one pod can equal up to 1 pack of cigarettes, which is 20 cigarettes, depending if the pod size is a little bit different per manufacturer. That pod may be filled to the point where it's even more than 2 packs of cigarettes. So we want people to be mindful. One thing we have not been able to do successfully in the United States is to be able to put these warning packages with these really vivid visuals. So you see, this is Marlboro, which is an American brand, but it's in every country, Asia, Africa, the Caribbean, Europe, it's everywhere. So this is advertisement from Pakistan, whereas this individual has succumbed to, well, I shouldn't say succumb, they have now an oral cancer. Part of their lip has been eaten away, and that's why you have this warning sign on a Marlboro product. We actually don't have that here in our country yet, but a lot of tobacco companies have been successful at being able to stop this type of advertisement. And just to show you what a healthy lung may look like compared to a smoker's lung, and all the chemical components that make up the tobacco, either smokeless or combustible, does start to give you these darker lungs because of all the tar that's involved in the smoke. So it doesn't matter your ethnicity, your gender. We definitely were born with healthy pink lungs, and when you introduce a toxin to it, this is what happens. Now, with the evolution of e-cigarettes, we're going back from 2006 to up to 2020, how the design has changed. I mentioned back in 2007 is when the United States first received got the market for the e-cigarettes, and it looked like an actual cigarette, but it's just, you couldn't light it with a match because it was electronic. And the designs had started to change. They were a little bulkier back in 2011. Juul came out in 2015, which has overtaken all the e-cigarettes on the market, and it's the most popular. So they're making them smaller and sleeker and even disposable now, where you don't have to worry about recharging them. This is just an example. This is Leonardo DiCaprio. I'm not saying that he is a paid sponsor. I'm not saying that, but this was at the Oscars, and if you look at the design he has, it's a little bulkier. So this was probably one of the earlier versions of an e-cigarette. And of course, he's popular. A lot of people want to emulate him. So the companies that are using these products and this advertisement is making it attractive. So if someone this healthy and glamorous looking can do it, well, maybe I can too. And if you see the marketing strategies, look at some of these flavors. I bring this to everyone's attention because these flavors are not really marketed for adults. You look at Kool-Aid, Hawaiian Punch, gummy bears, cherry, berry, Fruit Loops, Skittles. This is something that will attract younger people under the age of 18. And that's why we do have an epidemic of middle school and high school students that are now vaping, which unfortunately will become our adult patients with lung diseases, not just lung cancer, but other lung diseases. What we do know about electronic cigarettes aerosol doesn't include all the contaminants in tobacco smoke, which we'll go over a few. However, when it was originally recommended, if it was used correctly by adults, it may, and I'm emphasizing may, help in the cessation effort. E-cigarettes were supposed to help wean you, to transition you from regular cigarettes, to help you eventually quit the habit. But we realize that's not what's been happening. We also know that synthetic tobacco products are on the market, so you no longer need to grow tobacco leaves to make the product. It is being manufactured in labs. And we do know it's something that is attracting younger people. Look at the packaging, look at the colors, bright colors, and most of these are disposable, so they don't have to charge them with their batteries, and they just could take them and keep them for the whole day, puffing every single second of the day. When we talk about e-cigarette aerosol, I want to emphasize the word aerosol. It is not water, it is not a vapor. When you think of aerosol, you're thinking of hairspray, you might think of deodorant, you might think of something like Lysol, your cleaning products. So it is an aerosol, but all the chemicals that they add to it does not make the aerosol go down into your airways very irritated. It does not happen that way. It makes it smooth so you can tolerate it. If you took a traditional aerosol and sprayed that down your throat, it would not be pleasant. It's not something you would want to do. We do know some of the exhaled aerosol has heavy metals such as nickel, tin, and lead, very ultrafine particles, which allows them to be inhaled deeper into the lungs, which can cause lung disease. And we have diacetyl, which has been linked to lung disease. This chemical is also found in popcorn, the ones that we get at the movie theaters. Chemicals in tobacco smoke and vaping aerosols. One thing I do want to emphasize are the flavors that are being offered. We looked at Fruit Loops, we saw Captain Crunch, we saw cinnamon, we saw cherry. Under normal circumstances, those are not dangerous because those are food flavorings, food additives. When you bake, when you cook, you may be adding flavors that can be broken down by your digestive system, but not meant to be broken down by your lungs. So that's why we know this is causing issues. We know that there are 7,000 different e-liquid flavors on the market for people to choose from. When analyzing the chemicals found in the vaping aerosol, 2,000 chemicals were found that were not even identified yet. They had no idea what the chemical breakdown of some of these chemicals were. We know tobacco smoke has hundreds of the tobacco smoke when analyzed are toxic. We know there are 70 or more of them that do cause cancer. And unfortunately, we have a huge issue with middle school and high schoolers. For the state of New Jersey, I have data from 2019 and 2020. When we look at New Jersey compared to the rest of the country, New Jersey is doing better, but it doesn't mean we don't still have an issue. So about 15.5% of adults in the United States smoke, whereas New Jersey is about 11%. High school students, around 6% of the nation smokes. In New Jersey, it's around 4%. Now, when it comes to the other tobacco products, we talked about high school students when I mentioned the epidemic that we're experiencing, and also some young adults. You look at how many students, 27.6% are using e-cigarettes. So that's why I want us to remember that these chemicals that people are inhaling can become an issue as they get a little bit older. I always wonder the efforts that health departments, advocates, administrators put forth. Is it a deterrent to charge people more? And when I've had presentations in the past, most people say it's not a deterrent. When we look at the whole United States, the tax dollars that they try to use to deter people from buying tobacco products would be $1.91, and New Jersey is even higher, it's $2.70. So if your pack of cigarettes is around $8 and change or so, you're paying almost $11 for one pack of cigarettes. So I'm hoping that it is a deterrent for some people, but the feedback I'm getting is not really a deterrent. Now, what does the FDA say about e-cigarettes? One thing is that these products are basically, when they first came out, they were not FDA regulated. So a lot of these products did flood the market. One thing the FDA says is that they reject over 1 million products every single year for pre-market authorization. And when they see that something was not authorized, they ask the company to remove them from the market immediately. I don't think that's something that can really be done successfully, because once something hits the market and now you're telling them to remove it from the market, how many of these products have already flooded and people are using them, not realize they should not have been pre-authorized to be used? I spoke a bit about the chemicals found in tobacco smoke, and we're talking about the same chemicals also in vaping, which is smokeless. So some of the same chemicals that are found in tobacco smoke can also be found in our vaping products. We have, for instance, acetone, which is something used to remove nail polish. There's also formaldehyde, which we know is used in embalming fluid. So these are some of the chemicals that are making up your products, either smokeless or combustible. That's why you'll hear different schools of thought that some doctors do prefer patients switching to vaping products. If it was done based on the original purpose, it might help some people do it successfully with aid from a tobacco treatment specialist and counseling and with nicotine replacement. But on your own, just switching, you need to know what chemicals someone is absolutely inhaling. I mentioned about the youth issue of using e-cigarettes. This is from the CDC. We know that youth use of e-cigarettes is a public health concern. And unfortunately, we do know that secondhand exposure to e-cigarette aerosol contains nicotine and other harmful constituents. I've spoken at high schools where someone will say, I don't vape, but my friends do. So if you're around your friends, you're getting the same exact chemicals that they're exhaling. Health consequences of cigarette smoking. We know cancer is a major factor, but it's not just cancer, although in the United States, 1 of every 3 cancer deaths is linked to smoking, but we do know it's other diseases. There's COPD, which is chronic obstructive pulmonary disease, which is around the 5th leading cause of death in the United States, which can be linked to cigarette smoking. We know the lung cancer deaths. We know about heart disease. 33% of people with heart disease can link their heart disease to cigarette smoking. When speaking to consumers, they underestimate their smoking risk. One person that I treated went from a pack of cigarettes a day to half a pack a day, and that is commendable. Any effort to start weaning should be encouraged and should be congratulated, but that's not the full picture. Even if someone smokes 1 cigarette a day, they have a 64% chance, a higher risk of an earlier death than a non-smoker. So you still want to encourage the cessation effort for someone that is cutting down. It is a step in the right direction, but it's still not the end game. For instance, when we surveyed smokers, 71% did not believe they had a higher than average risk of heart attack. 60% didn't believe they had a higher risk of having cancer. They didn't believe they had a higher risk. Now, when we spoke to heavier smokers, which is 2 packs or more a day, 61% did not acknowledge that they had a possible risk for heart attack. 51% did not acknowledge. 51% didn't believe that they were at a higher risk of unfortunately being diagnosed with cancer. When we talk about stages of lung cancer, there are different stages, and that's why we are talking about lung cancer screenings and how we can save lives. If someone is a smoker and a physician recommends that they do get lung cancer screening, you want to catch the lung cancer screening at the first stage, at least, or the second stage when you have an opportunity to have surgical intervention, chemotherapy, and also immunotherapy and radiation, depending on what's right for you. But when we're getting into stage 3 and 4, we're looking at metastasis, which have gone to other organs, which unfortunately at that point, you may not have many more options. And sometimes a lot of people, unfortunately, do not get diagnosed until the later stages. And when we talk about the development of cancer, normal cells can develop into cancer cells, unfortunately, but normal cell development, all our cells divide. That's cell division, and it creates healthy tissue. But when something goes awry with the DNA, your normal cell has a genetic issue where it's damaged, it's exposed to toxins, and a cancer cell develops. And of course, that cancer cell will still go through cell division. And as it keeps dividing, multiplying, that can become a malignant tumor. Cancer burden for the state of New Jersey. We know that there are statistics that are being taken. So when you're speaking to other individuals, they know these numbers that you're getting are real numbers, which we can always see on these different websites. 2019 records show that there were 54,271 new cases of cancer. For every 100,000 people, 484 cancers were reported. So that goes to show you that, yes, the smoking rates are down, but there's still a lot of work to do. Look, in 2019, there were 5,839 new cases of lung cancer and bronchus cancer. For every 100,000 people, 50 lung and bronchus cancer cases were reported. So I just want everyone to be aware of why we do these educational components. We look here for 2019 when it looks at rates of cancer deaths across all races, ethnicities, and genders. You see that the highest rate of death was attributed to the lung and bronchus cancer. Yes, there are other people dying from other cancers, but we do know lung cancer is one that unfortunately has the highest rates that people succumb to the disease. Here we have top 10 cancers by the rates for 2019, and this is across all races, ethnicities, and genders, and cancer does come in third. This is the top 10 new cancer cases. So even though it came in third as a new cancer, depending at what point you have been diagnosed can make a difference into your survival. And unfortunately, a lot of people do die from lung cancer. When it comes to lung cancer screening, what is it exactly? Cancer screening is looking for cancer before a person has any symptoms. And this can help find cancer at an earlier stage, as we talked about earlier. When abnormal tissue or cancer is found early, it may be easier to treat. Unfortunately, by the time the symptoms appear, cancer may have already begun to spread. So the point of all of our conversations with patients and family members is I get checked early. If you're smoking, you're at risk for cancer. Get checked as early as you can. Now, importance of lung cancer detection and screening. We are making it very clear that we know when we find the cancer in an earlier stage, the prognosis is better. Lung cancer symptoms appear late, unfortunately. So someone can be walking around with cancer at stage 1 and may have no clue, no inkling, because they don't have any symptoms. Only 16% are detected at an early stage, and we need to actually increase that so we can catch people earlier. About half are detected at late stages when treatments are ineffective. So we want people to realize that when someone is exposed to tobacco, that is why you'll hear this message. Who's eligible for lung cancer screening? Now, the United States Preventative Services Task Force, USPSTF, has changed back in 2021. They realized they needed to get to more people, so they changed their requirements. So what they did was it was 55 to the age of 77. They now lowered it to start screening individual as early as 50 years old and extend it up to 80. And it goes with a couple different criterias. If you are someone that had quit within the last 15 years, but you were a smoker and you fit the age, I think you would probably be someone that would be recommended to get a lung screening. Even if that person quit 15 years ago, there's still some possibility that they could have developed lung cancer. So we look at the pack years, meaning how much you smoked. At one time, they were only screening individuals who smoked 30 pack years or more, meaning up to 30 years if you did 1 pack a day for 30 years, or if you did 2 packs a day for 15 years. So they definitely changed the criteria so they can absolutely help and treat more people. Smoking and lung cancer. We do know that smokers are 25 times more likely to develop lung cancer compared to people who never smoked. Smoking causes about 80 to 90% of all lung cancers in the United States. So we want people to know these numbers are real, and that's why I have information, the websites you can go back. CDC will give you a lot of breakdowns. You also know smokers today are at greater risk of developing lung cancer. The cigarette design has changed, such as the filter and the vent holes may lead to deeper inhalation. If you remember a few slides back, I talked about the fine particles from the e-cigarettes. Those fine particles allow you to inhale, and you get that deeper inhalation, and also the changing chemical, which is unfortunately carcinogens, are what we know can cause cancer. Lung cancer screening and linked to tobacco treatment. So when someone is a smoker and they're coming in for lung cancer screening, this is a great opportunity and to get them to rethink about some of their habits. And most people that may come in for lung screening are usually motivated to quit, and this is a great time to introduce some comprehensive tobacco treatment. Patients have contacts with different clinicians who can reinforce at least brief and at times more intensive tobacco treatment. You could be referred to a specialist. There's also annual repeat scans, and you want to be able to offer tobacco treatment to all users. Even if they're not quitting immediately, it's something you should keep on their radar that they want to do at one point. Other causes, risk of lung cancer. We said previous slide, cigarette smoking causes 80 to 90% of lung cancers, but there are other risks that can give someone lung cancer. You don't only have to be a smoker. Exposure to radon, exposure to secondhand smoke. You have environmental exposures. For instance, work exposures to asbestos, arsenic, diesel exhaust, and some other forms of silica and chromium, and a family history of lung cancer. So you have mechanics, you have people that may have worked in the auto industry, not just as a mechanic, maybe as designers or testers, the airline industry, they may have been exposed to some of these chemicals. Now, radon is something you cannot smell. It's something you cannot see. Radon is found deep in the ground, and it does pose a risk. So we do know that New Jersey has resources if you suspect that you may have radon exposure in your home. Usually, whenever someone is buying a new home, that's one of the things they will test for is radon. And I have an information website and a phone number someone can find out about. So someone being exposed to radon, unfortunately, can develop lung cancer. There are 20,000 lung cancer deaths each year from radon exposure. We talked about secondhand smoke exposure. For instance, in this photograph, you see an individual who's not driving, but is vaping. And that aerosol that's being exhaled, that person in the driver's seat, passengers in the back, they're inhaling everything this person just exhaled. Adults who do not smoke are exposed to secondhand smoke increase their risk of developing lung cancer by 20 to 30%. Secondhand smoke causes more than 7,300 lung cancer deaths each year among US adults who do not smoke. So just think of people who did not know that they were exposing their children to secondhand smoke in the 70s and 80s and 90s, before there was really a push to understand that you shouldn't be smoking in the car around other people, especially children. Third-hand smoke is something people somewhat know about, but third-hand smoke is what is left behind long after someone has stopped smoking. It may stay in your carpets, your wall, your furniture, in the car, in the cushions, toys, and even people's pets that are crawling around are getting third-hand smoke exposure. So this is someone who can have purchased this car, and that person who purchased this car does not smoke, but they're still smelling the chemicals long after no one is smoking in that car. It can be months and up to years that if you were to get a detector of some of these chemicals, they would test positive. Asbestos, we talked about as an environmental exposure from someone who may have been building homes, let's say. Asbestos is a heat-resistant material that was used for insulation in older buildings. This research does show that it usually takes about 15 years after exposure to develop lung cancer. So people who worked in asbestos mines or industries are definitely at risk for developing lung cancer. Lung cancer symptoms, I mentioned before, some people do not even know they have stage 1 or stage 2 because they often don't have symptoms until the cancer becomes advanced. Some symptoms may be coughing that gets worse or doesn't go away. Some people may even confuse that with like a COPD or emphysema. Sometimes they'll have chest pain, shortness of breath, weight loss that is for no unknown reason. They have no way to link why they had the weight loss, coughing up blood. And sometimes they just feel extremely tired. They may not always tie in all these symptoms with a lung cancer. When we talk about lung cancer screenings, there are benefits. So when we do the trials, sometimes people only get x-rays, but what's recommended, a CT scan images provide more information by creating two-dimensional cross-sectional images. So that's why someone would be able to see, is there a nodule in the lungs? Is there a tumor in the lungs? And if something is found, they look at the size. Depending on the size of the nodule, they will either say, we'll watch it. If it doesn't grow, then we know it might just be a benign tumor growth. And that's one thing about what is a lung nodule. A lung nodule is called a spot on the lung or a shadow. A nodule is round an area that is more dense than normal tissue that makes it stand out. It shows up as a white spot on a CT scan, and it could be caused by scar tissue or a healed infection. It doesn't mean that it's cancer. And sometimes irritants in the air can cause you to develop these little tissues that show up. And it can also be early stage lung cancer. When we talk about components of oncology care, I had mentioned before, if someone has treatment, they usually may be offered radiation, surgery, chemotherapy. But what we want to do, instead of having these three main components, is also add tobacco cessation, because we know smoking causes 80 to 90% of lung cancers. So someone should be offered tobacco cessation. Just because someone is diagnosed with lung cancer, they can still benefit from not smoking. So smoking cessation is designated as the fourth pillar of cancer care. That is what most clinicians would like to see. Rationale for screening and tobacco treatment and tobacco dependence in cancer settings. We know persistent smoking is a modifiable risk factor associated with morbidity and mortality and cancer care. We do know that if you're getting treatment, your treatments may not be as effective if you're smoking, so there's drug interaction. Now, you're being treated for one cancer, you're at risk for developing a second primary cancer, or that cancer that was treated successfully, there's a possibility you can have that cancer come back. You may not remain in remission, and your quality of life will be diminished. We know that if you offer someone evidence-based guidelines for effective tobacco treatment, they have a better chance of being able to successfully quit. We know that it's something that some clinicians may not always remember to find out someone's tobacco status. So we know that sometimes the treatment is low and oncology providers miss opportunities to advise patients to seek treatment. For instance, we talked about the risk. We talked about the benefits of the trial. We talked about the risk of smoking. We know that the low dose CAT scan demonstrated a 20% lung cancer mortality reduction compared to the chest x-ray group, which I mentioned prior, that if you have a CAT scan, you're able to see better because of the cross-sectional imaging. We look at the deaths. When you look at the number of deaths with the low dose CAT scan was 17.6%, which was 1,000 per over a 7-year period, whereas 20.7 individuals, it was more with the chest x-ray group because perhaps we didn't catch the whole cancer. So that's why you'll find that a CAT scan is recommended even after a chest x-ray was done. It'll help reduce us losing individuals. When we talk about the benefits, we also know that there can be some risk when we do national lung cancer screening. For instance, there's false positives have shown to identify both cancerous and non-calcified nodules, which we talked about as a white spot that can be thicker, not necessarily cancer. So we know that that could be a false alarm and someone may be subjected to unnecessary testing. Of course, we hope that no matter where someone gets scanned or diagnosed, that that's not something they would fall under, but we know that is a possibility. Overdiagnosis. Screening may find cancers that would not ever cause symptoms or harm a patient in their lifetime, leading to treatment that they most likely did not need. So as many benefits as there are also risks, and that's why we should be very well versed in what these modalities are. One thing we know for sure is that tobacco hurts more than your lungs. Tobacco use is the single most preventable cause of disease, disability, and death in the United States. I'm repeating it again because it's something that should be repeated to remind people what tobacco does. Smoking can cause cancer almost anywhere in your body. It's not just your lungs, it's not just your heart. We have people that are struggling with infertility that has been linked to smoking. We know some cervical cancers, when they do pap smears and they do tissue samples, they found some of the mucus did contain nicotine and some of the other chemicals that are found in tobacco. So I just want everyone to be aware, it's not just your lungs, it's anywhere in your body. Eyes can be affected, your vessels are constricted, causing less blood flow, less oxygen, and your vision may need to be absolutely addressed due to the smoking. Not only is it something hurting us physically, but there's also a financial burden of vaping, because we talk about vaping and combustible, so we know that that's emerging, so we should also discuss it and how it is costing money. Single-use disposable electronic cigarettes can cost anywhere from $1 to $15 each, or even more. And I do know there are individuals that are using more than one disposable e-cigarette pod or device a day. Rechargeable starter kits where multiple pods can cost anywhere from $25 to $150 or more. You can buy the liquid kits that you can refill, and that's anywhere from $50 to $75 a month. This is actually one of my former patients when I did a cost of smoking tool. I said to him, how much do your cigarettes cost? He said they cost me $10.50. I smoke a pack a day. So he smokes I said, okay, let's just do it for 1 week. For 1 week, you're paying $74. For the month, you are paying $315. And for the year, you're spending about $3,900 on your cigarettes. Now, 10-year period, look at how much money you would have spent. It's about $58,000. In 20 years, more than doubled, and look how much that you're spending. Now, the cost of cancer treatment, and when I say cancer treatment, I'm not referring to, unfortunately, like we see the commercials of these young children, like St. Jude, who treats children. I'm not talking about that, who for no fault of their own have leukemia. I'm talking about the cost of cancer treatment per smoking patient, that their cancer can be directly linked to smoking. It cost us taxpayers $10,678 per smoking cancer patient. For the whole United States, it came to $3.4 billion. So we all pay for this in a way, and it's why we want to make sure we break down not just the health component, but the financial component. When it comes to smoking, using tobacco, vaping, I always say it's not a lack of willpower, because most people who use tobacco products, they are aware that they most likely are bringing themselves to a point where they can develop a disease, not necessarily cancer. We talked about COPD, emphysema, but cancer is high on the list. I want people to understand it's addiction that causes people to keep vaping and smoking, using tobacco. It is absolutely addiction. I'm giving you examples of clinicians who know better, who should not be smoking, and they have an addiction, and that's why they remain smoking. I have patients, when I was back in my earlier career, working at a level 1 trauma center, working with the ER team, we may have had someone that we stabilized after a huge car accident. Now that person's off to surgery. And what did half of the staff do? They all went outside with their scrubs and their stethoscopes and were smoking. I've had patients that have asthma or some other lung diseases that they need inhalers, and they'll go outside and smoke, and then they'll come back in and wait to get their breathing treatment. So we know it's addiction and not a lack of willpower. When we talk about nicotine, what is nicotine? It is a highly addictive stimulant drug that speeds up the message traveling between the brain and the body. It is considered the main psychoactive ingredient in tobacco products. We don't need to have a tobacco farm to grow tobacco leaves. It can be produced synthetically in the lab, and that's the chemical breakdown, as you see there, for tobacco. What happens to most people that are using tobacco, either combustible, as in cigarettes, or smokeless, they have these neurotransmitters that lights up like the 4th of July fireworks. They get an inhalation that they can get within 8 seconds with regular cigarettes. It's even less with electronic devices. You get that to your brain. Your brain lights up like the Christmas tree. The brain releases the neurotransmitters. You have dopamine. And as soon as you're done with your vaping or your smoking, those nicotine blood levels starts to fall. The brain starts to crave it again. And then you're starting to cycle all over again. So I want you to remember, it's not a lack of willpower, but it's absolutely addiction. And dopamine, it's what they want when they smoke, is the dopamine release, the feel-good hormone. And if you see there, when I said the brain lights up like 4th of July fireworks, that's the rush you get when you have introduced a psychoactive drug, and your receptors are binding to it and enjoying every moment. But then you get the crash, and then you want it again. So that cycle is pretty vicious. Most addictive drugs, we know there are 5 most addictive drugs. These are not the only ones, but these are the 5 most addictive. As you can see, nicotine is in the same category as cocaine and heroin. The only difference is you will not get arrested for buying nicotine products. And if the health department had their way back in the 1950s, or the FDA, CDC, they wanted to have nicotine banned just like cocaine and heroin, but the tobacco lobbyists were very successful at not having that done. Signs of vaping addiction, and I ask this to people that say, oh, I only vape, it's not that bad. However, if you keep vaping, even though you know it's bad for you, most likely you're addicted. If you have trouble concentrating or sleeping, you're most likely addicted. You feel anxious or irritable when you want to vape and you can't, and you go out of your way to get e-cigarettes. If you answered yes to some of these questions, you are most likely addicted. Why should someone quit smoking? We talked about the financial part of it, and we do know quality of life is important in your health. Food tastes better. Your sense of smell will improve because you're not coating your tongue and your airway with all those toxins. You will also be able to avoid disruptions in your day. If you're someone that was constantly vaping and smoking, whatever it is you're doing now, you can put your full attention into that. Now, we talked about finances a little bit, but that's not always a key factor for certain people. Sometimes they think about family members and their friends that want them to quit. That might be enough for them. We've had grandparents that say, I want to be around for my grandchildren and I want to grow old, healthy. When we do know someone needs to receive tobacco treatment, they are usually referred to a tobacco treatment specialist. What we can do is you do provide supportive evidence-based treatment to show them that this is information that's absolutely based on success and data. What you do is you want to do a planning, you want to implement a date, you want to discuss it as shared decision-making with them. You'll let them know that their individualized treatment plan, even if they're within a group, you can do this telehealth, virtual, or in person. You want to talk about relapse prevention because unfortunately, it's not going to be the first attempt. It takes several attempts for someone to be successful. You want to be able to follow up and you want to be able to provide ongoing support. We briefly mentioned like the evidence-based. Evidence-based would be medications and support that we know has been proven to work. There are 7 FDA-approved medications. E-cigarettes is not one of them, although they are marketing them as such. But we have traditional patches, gum, and lozenges. There's inhalers, and there are prescription medications that can be taken orally that may help different people. You pick what's best for the person you're treating. You can't say one is better than the other. You treat what is absolutely best. Why smoking cessation is so important with cancer patients? Unfortunately, 64% of patients who are diagnosed after cancer still smoke, even after the diagnosis. 1, they have the addiction, and 2, they're going through a new situation that they weren't anticipating. So that's why we need to be patient to remember it's not a lack of willpower, it is addiction. When someone is still smoking after a cancer diagnosis, we know it lower overall the cancer-specific mortality. There's a higher adverse effect with cancer treatment. So we want to remind people that we can no longer ignore smoking when it comes to overall survival. Effects of smoking on cancer. This is just something I want people to be aware of. There's a 50% increase in all-cause mortality of cancer for patients who smoke. A 61% increase in a relative risk of cancer-specific mortality. I mentioned briefly that the cancer you're being treated for, you may not respond to the treatment effectively, and you're at risk for developing a secondary cancer. Provider knowledge. Some healthcare providers are unfamiliar with lung cancer screening guidelines. We do know that there was a study that showed the primary care providers and pulmonologists, 43% reported needing more information on the eligibility criteria, 69% correctly determined screening eligibility for 3 of 4 patient scenarios. Of course, you'd want that to be a lot higher. So it's a whole team that can help everyone to get the patient to the care they need. I briefly discussed a shared decision-making. This is when you're speaking to someone about what do you think we can help you do to support your efforts in cessation, stopping smoking. It's not a one-size-fits-all for everyone, so you really need to include the person involved in this new challenge and not just give them orders, but make them feel like they're part of the decision. Eligibility criteria, what does that actually mean by the changes that were made? We see that the different criteria from 55 to 77 is now 50 to 80, and the age group could save 30,000 to 60,000 lives in the United States each year. And unfortunately, we know there's some groups that are still experiencing some health disparities. So the more we know, the more we can help everyone. These are some quit smoking services in the state of New Jersey. Most of these are offered for free, if not all of them. And again, I want to advise that you will get individual assessments and they will pick the best treatment plan for yourself. And you will do that with the help of a certified tobacco treatment specialist. In summary, lung cancer screening with low-dose communitotomography, LDCT, reduces lung cancer death rates and overall mortality rates. Those eligible for lung cancer screenings under the new guidelines, we know that the guidelines are catching more people. We want to remember that there's an important link to lung cancer screening and tobacco treatment. Once someone comes in for tobacco treatment, we can speak with them about getting tobacco treatment. Resources are available to educate patients, clients about tobacco cessation and lung cancer screening. One thing we know is that smokeless tobacco is just as addictive. Smoking e-cigarettes are expensive, and we still do not know the health effects, the long-term health effects of vaping. So thank you for listening. I have an evaluation here that you can scan with your smartphone, and you will be able to fill out the evaluation, and it will come up looking as you see displayed here. Thank you everyone for listening, and I have no problems taking questions. I'm available.
Thank you very much, Monica. And we are gonna move to our Q&A session. That part is not recorded, but before, I just want to take a minute to give a big thank to the Rutgers Cancer Institute of New Jersey and the whole team, especially to you, Monica and Ryan Moulton, who is also joining us today, and Cecilia Gomez, as well as to Ashley Purper. All of them, you guys did an amazing job presenting and bringing information. And to you, Ryan, for putting all this presentation together. I know it was like a big effort, going back and forth in relation to making sure that you guys were able to include the information that the community needs. So thank you, everybody. And with that, we're gonna move to our Q&A session. Thank you very much, everybody.